Good evening, everybody. Thank you for joining us for day 3, our final day of Aware for All Atlanta educational program. On behalf of SysGroup and our supporting organizations, I have the pleasure of welcoming you to this event. And if you joined us on either of our other events this week, you probably recognize me. But for anyone who is new, my name is Hope Venturcelli, and I am the manager of events and community engagement with SysGroup. And I've had the pleasure of developing this program with many of our Atlanta-based organizations. SysGroup, or the Center for Information and Study on Clinical Research Participation, is a nonprofit organization dedicated to educating the public on clinical research. We do not conduct trials or recruit trials, but believe that everyone should have the information they need to be informed about clinical research. And we want to help connect you with as many resources as possible if you want to learn more. And I am thrilled to kick off tonight's program and share the perspectives of those who are involved in clinical research. And we'll be focusing on the perspective of professionals in the clinical research field and those who work in the community to build more awareness about clinical research. But before we begin, we ask for your feedback. And we want to make sure that this is a meaningful program for you. And we have a few poll questions that are going to pop up on the screen tonight. And those poll questions will also be your raffle tickets for the evening. So you can also use the Q&A to engage with our speakers to be entered into the raffle that way as well. And we understand that you may have some questions that you'd like to ask anonymously, and you should feel free to do so. But if you would like to be entered into the raffle that way, you just shoot us an email at awareforall@sysgroup.org. So to kick it off, I'm going to start with an easy question. We just want to learn a little bit more about you. Let's see why you are joining the webinar tonight. And you're participating as a member of the public, a member of an exhibiting organization, or a professional involved or associated with clinical trials. So that poll should be up on your screens now, and you'll have a few moments to answer that here. Awesome. A few more moments on this poll question. All right. Thank you to everyone who's able to answer that. Now, SysGroup was honored to collaborate with important organizations in the area, both community and research organizations who help to spread the word about the Aware for All program. And you can visit many of these organizations in our informational exhibit center through our website by visiting awareforall.org and clicking on the Atlanta event. And our informational exhibit center is always open. You can visit that whenever you'd like to learn and explore. You can share it with your friends and family, or just return to learn a little bit more about the organizations involved. And this information and other helpful links will be also included in your follow-up email that you'll receive after the program. I'd also like to thank our generous sponsors and other exhibiting organizations. These past few months, these dedicated individuals have helped to organize this week's virtual program. So the Allergy and Asthma Network, Georgia NCorp, iResearch Atlanta, Praxis Precision Medicine, and many more. Without your help and support, this program would not have been possible. And again, you can find some educational content and more information about all of these groups in our IEC. And a special thank you to our Aware Industry Consortium, Biogen, CSL Behring, EMD Serono, Genentech, IQVIA, Janssen, Novartis, Otsuka, Pfizer, and WCG for providing support to this educational program to bring it to 5 different regions this year. Thank you all for your continued support. And again, if you have any questions throughout the event, please shoot us a message in the Q&A box, and our team will be monitoring the Q&A and will bring up those questions that you may have during that portion for our team or our speakers to answer. All right, and so you should be seeing another poll up on your screen now. And we just want to know if you have any inkling about the way that medicine can respond in different people. So this is a true or false question. If you participated in our webinars earlier this week, you may have an idea of this answer, but there's no wrong answer here. We're just trying to gauge if you are aware. And then this is really helpful information to us as we continue to build this program out and see what information is most beneficial to you guys. I have a couple more moments here with this poll as well. Right. Thank you very much to everyone who's able to answer. And again, there will be another poll question before the end of the night, and engaging with that Q&A box is a great way to be entered into our raffle as well. Now I would like to welcome our founder and board chair, Ken Getz, who will be moderating our panel tonight. We have a number of really great speakers. So Ken, take it away.
Great, thank you so much, Hope. It is really my pleasure to be here today for day 3 of Aware for All Atlanta. And as Hope mentioned, this is really a special opportunity for all of you to get to meet a panel of professionals who are involved in clinical research in a variety of different ways. They may be involved in actually conducting clinical research, in planning clinical research, as well as involved in even advocating for patients and their families. So this is really a great opportunity to hear their perspective. And I'm going to begin by asking each of our panel members to introduce themselves. I'll mention their name and then they can turn off their camera and turn off their mute and tell us a little bit about their role and responsibilities within their organization. And Leah, I'm going to invite you to make an introduction first.
Thank you, Ken, and thank you, Hope. I'm so honored to be here tonight and joined by my fellow colleagues. My name is Leah Szumita. I am the director of the Clinical Trial Support Center at the Leukemia and Lymphoma Society. I lead a team of 10 nurse navigators with lots of varied expertise in hematology and oncology. And we work with patients or caregivers with blood cancer to help identify potential clinical trials and then overcome the barriers to enrollment.
Great, thank you, Leah. Tamara, can I invite you to join us now and introduce yourself?
Sure, thank you as well for having me today. I'm really excited to be a part of this. I am Tamara Wahisi, and I am the Medical Surgical Research Supervisor at Northside Hospital, Atlanta. And in that role, I am basically responsible for the operations behind getting clinical trials started that are essentially not oncology trials. So anything that's coming through our research department that touches on any other indication will come through myself operationally and my team, which will soon be 5. So I work with coordinators, nurses, and data, as well as regulatory and our finance teams to implement the trials. And sometimes I hop on in a coordinator role as well, and I work one-on-one with the patients to make sure that, everything is sound and feasible, and we're enrolling qualifying patients to the studies.
Great. Welcome to both of you. Meghan, if you can introduce yourself as well.
Hi, everyone. Hi, Ken. Hi, patients, caregivers, physicians. I love being in this room with everyone. My honor. I'm Meghan McKenzie with the Chief Diversity Office in Genentech. I work in the Patient Insights and Health Equity Group, and a lot of my work is around advancing inclusive research, which is trying to improve representation in clinical trials, ensuring that the patients in our trials mirror the patients with the disease we're studying, and really better reaching communities of color. I am a patient myself. I'm twice survivor for melanoma. I'm in a biomarker study. I'm in a registry study. So I try to live what I work. I know that we have found new targets from biomarkers that we've contributed. And again, my honor to be here. My favorite thing is to talk to patients. I was just in Tennessee interviewing a patient and in Alabama interviewing a patient. And I am a Hotlanta native. I was born there. So happy to be in the room with everybody.
Great to have you with us, Meghan. Yolanda, over to you.
Having a little camera issues. Hopefully I can get it turned on.
It's working fine.
Well, okay, there we go. Hi, everyone. Thank you again for inviting me to be a part of this panel. So thank you, Ken. Thank you, Hope. I'm Yolanda Little, and I've worked in clinical research for, I'm going to tell my age, probably about 23 years, and I've been here at Novartis for 16 years. And my role here at Novartis is to create and execute patient recruitment and retention efforts for underrepresented populations across our US clinical trials. And I have to tell you a little secret. This is my first panel that I'm participating in, so I'm so proud that it's a CISScript event. So thank you for having me.
Oh, that's wonderful. Thank you. Zach will now introduce or turn it to you to introduce yourself.
Hey everybody, thanks for inviting me to tonight's panel. So I am the Director of Operations and Recruitment for iResearch Atlanta and Savannah. I'm born and raised in Atlanta, so basically a unicorn. And so I wear lots of hats. It sounds, I do all of our, I kind of look for the different clinical trials to bring to our communities. And then also just wear many hats with helping our recruitment teams meet our demographic goals. And yeah, that's a little bit about me. So thank you.
Terrific. And Mary, now we'll ask you to turn off your monitor and introduce yourself as well.
Sure. Good evening, everyone. My name is Mary Slomkowski. I'm a senior director in the clinical management group at Otsuka. Otsuka is a pharmaceutical company, and a lot of our research is done in the CNS area, psychiatry, neurology. I'm a pharmacist by training. Been in the industry, however, for the last 20 plus years. And part of my role is to look at our CNS portfolio, work with sites and centers to make sure that we're executing the trials as it's written in the study, ensuring quality and helping to outreach to patients who might be interested in participating in a research study.
Great. And last but not least, Phyllis.
Good evening, everyone. I'm Phyllis Kaplan. I live with type 1 diabetes, and I've participated in several clinical trials, both in person and virtual. So really my role here tonight is to provide that patient perspective on the conversations that we're all having tonight.
And Phyllis, I'm going to put you on the spot a little bit, but can you talk for just a moment about your role at SysGrip as well, just so people can see that your professional hat as well?
Yep. So my day job, so to speak, I am the senior manager of events and community engagement here at SysGrip. So it's a double honor to be actually on a panel for one of our events.
Well, it is so wonderful to have all of you here. You each bring a special perspective, and there's so much we can learn from all of you. This first question that I'm going to pose is really one that will help our audience understand how the patient and their family factors into the day-to-day activities that you're involved with. So maybe, Tamara, if we could start with you, can you talk about ways that you think about and weave your knowledge about patients and their families into all of the things that you do?
Most definitely. Obviously, with clinical research, our patients are the backbone to these various trials. Without them, we would not get the data and the information that we need to advance the technology and the drugs that we're studying. So, we have to be sensitive to the patients that we're approaching and what their various perspectives are in terms of what they know about clinical research. I think that you have to understand your audience, know your protocols, and definitely approach them in a gentle fashion and help them understand that we are offering them an opportunity that maybe they otherwise would not have. I think it's good when we know all the things that we're supposed to know about these trials and we can pass that information on. And, one thing that I've always liked about being in a coordinator or a nursing role in research is that when you do engage with a trial participant, I like to tell them that it's almost like concierge service. And, you get to really get to know your patients. You work with them very closely one-on-one, and they have a different avenue to getting the answers and the information, the prescriptions, whatever they need, the appointments, from the office in a faster and more personalized manner. And so I think it's helpful. There's a lot of information in these protocols and the consent forms. And I think it's all about the way that you approach the patients and deliver the information that makes them feel comfortable and want to participate in the trial. So
that's great. Zach, I'm gonna pull you in now because obviously you have a perspective as someone at a research site as well. And just to add to and build on what Tamara has said.
Yeah, so pretty much exactly what Tamara said, right? They basically, patients are treated like royalty in research, right? They're offered care that they may not be able to receive. And I think the level of care that you get from a research study is just so much higher than just going to your regular PCP or psychiatrist office. At clinical research sites, we don't just start you on a medication and see you in 30 days, right? We're going to see you later this week, probably next week. We're going to send you home in an Uber if you don't have transportation. We're going to provide you a copy of your labs for free so that you can, know what your health looks like. And so, yeah, I definitely think that at a site level, what's been kind of fun is just reaching a ton of different patient populations, right? So we do multi-therapeutic indications, so anything from psychiatry to infectious disease, vaccine, neurology, and to kind of see how when you bring all these people together in one office, just really how a clinical research site looks and feel in terms of patient centricity really is valuable for other patients as well.
That's great. Now, 15 years ago, so much of the interface was really between the research center and the staff at the site and patients who were participating. But today there's so much planning, there's so much input that the sponsors of research receive, that patient advocacy groups are also behind. So let's now open this up to our other panel members. And Meghan, if you can talk about some of the ways that patients really play an active role in informing our planning within a sponsor company, and so many of the other critical ways that sponsors help direct and develop our studies.
Thank you, Ken. And Ken, you know very well the complexity of the studies that have grown over the past 10 plus years that have become a huge burden for sites and patients. So we really need to dig in on the must-have versus nice-to-have procedures in order to safely monitor patients. But I can tell you, patient insights change behavior. So even one patient story can impact us to think differently. And so every opportunity we can get, we're talking to patients. We have a patient co-creation council made up of about 170 patients from all different ancestries. I am very honored to be interviewing patients in the field about the work that we're doing and try to improve community engagement. But I have seen one patient change our protocol design. Interviewing an amazing woman with ALS, and she said, you think urine easy to get, but when you're in a wheelchair, it might take a little longer. So really listening, we maybe don't need to get urine as often. Maybe we don't need to get the blood as often. So really forcing us to think deeply about what is a must-have versus a nice-to-have. And but those patient interviews really do motivate protocol authors to change what they do. It just, you think you know, and then you talk to a patient, you're like, yeah, you don't know. You really need to listen more. So very grateful for the patients who've given us their input. And they also change outcomes. They validate measures for outcomes. Those are some of the ways.
Yolanda, let me invite you to comment now. And in particular, if you could talk a bit about how you have to think about customizing patient recruitment activity and a lot of your outreach in order to really accommodate different needs of some of the participants in our studies, and how that factors into a lot of your planning and a lot of the work that you do.
Well, yes. So without our patients, we don't have a study. So it's really important that we are culturally competent and really meet the needs of the patients that we are trying to treat. And it also goes into just being aware and making sure that there are no biases against, the patients that you're trying to recruit. Making sure that the information is culturally relevant, making sure your consents are in multiple languages as well. And just reaching out to the community, building that trust, because through that community, you're going to be able to reach the patients that you need for your studies. And it's very important that we have representation from a heterogeneous society to ensure that our drugs are going to be effective on the patient population it's intended to treat.
And we'll come back to that because this is obviously such an important topic as we think about the importance of diversity and inclusion in our studies. Mary, can I draw you in now? We've sort of heard perspectives from a couple of different panel members who are within sponsor companies, and let's just hear from you and Otsuka's role in really amplifying the voice of the patient in a lot of the work that you do and you and your colleagues are involved with.
Sure. I mean, patient input for us and the way we design our trials is becoming just is a core and central part. And it's new and evolving, but to Megan's point too, it's become so important that we could think we're the smartest people on the face of the earth, and we could design a pristine experiment study. But if it isn't able to be conducted, it doesn't go anywhere. So we quite often will run patient advisory boards where we bring a group of patients together who might have the illness we're studying, and just to pressure test our protocol of what they think against it. Is the trial too burdensome? What activities cause them concern? Does the consent make sense, or does it offer too much jargon that isn't understandable? And I think, again, to the core of really understanding, walking their shoes and understanding their disease state, so that, you know, if we can get rid of a blood draw or a urine or whatever the case may be, as Megan has said, that we really listen to them and we do it, you know, and really bring forward what's the most valuable pieces.
So let's now turn to our two colleagues who are really involved directly in patient advocacy. And Leah and Phyllis, I'm sorry, I'm coming to you last, but we'll go to Leah first. Can you sort of build on what you've heard? I know there's so much that's done within your organization to also make sure that you're in tune with your membership, with patients who really rely on your organization. Can you talk a bit about how that factors into a lot of your planning and the work
Absolutely.
that you do?
Yeah, absolutely. So, you know, I share the sentiments of all of us on this panel with everything that's been brought up. And I think, you know, to put a little data behind it, just about 20% of cancer clinical trials close simply because they never accrue enough patients. So, you know, to Yolanda's point, we want the population of patients in a study to be representative of our very, you know, diverse society. And so, you know, we need to do that. And I think knowing that clinical trials, and I'm coming from the cancer perspective, really are the key treatment and advancing treatments, we need to help increase awareness. And I think that requires a multifaceted approach. First, you have to debunk some of those myths about clinical trials. And I'm sure we're all doing that every day in our practice. And, you know, education about what clinical trials really are and what is involved in them is hugely important. Having the voice of the patient to really make sure they understand the impact of their quality of life when they participate. I think, you know, there's so many barriers to clinical trial enrollment that are in the literature, and, you know, they're not surprising. It's, you know, the strict inclusion exclusion criteria, the financial concerns, because clinical trials aren't free. And we have a very complex healthcare system right now. And, you know, the ability to travel and be away from home for a period of time is really hard. And particularly for people who are in rural areas. You know, many of us here are in very resource saturated areas of the country, but many people are not. And so, you know, we talk about the frequent lab draws and the frequent visits. It's just nearly impossible for such a huge amount of patients. So, you know, we need to try to increase the awareness. We need to try to make it more feasible and realistic for people to participate. And, you know, the Leukemia and Lymphoma Society really focuses on trying to, you know, increase the accessibility and access to not just clinical trials, but standard of care, whatever it might be, whatever's in the best interest of the patient. So, you know, it's just also important, but yet so complex. I always tell people, like, wanting to enroll in a clinical trial and actually enrolling, it's not a straight path. There are just so many bumps in the road, and, you know, having someone to help navigate and kind of hold that person's hand along the way is hugely valuable.
Great. And Phyllis, if I can just ask you to build on what Leah has said, a lot of her perspective obviously is part of the CISCRP mindset as well.
Yeah, I think, you know, some of the topics that have been brought up about, you know, really getting the patient voice, so to speak, even before the clinical trial starts. So I've several examples of that, but most recently during a virtual clinical trial, there was the team was under the impression that an EKG was part of standard of care for people who had diabetes for more than 20 years. And that wasn't the case for me. And they didn't have a clear-cut way for me to go and get this test because it's not part of my standard of care. I can't just call my doctor's office to get one. You know, health insurance and the way, our healthcare works doesn't allow for that. And I spent several hours on my own trying to call hospitals and get, out of pocket costs because that was part of it too. So, long story short is they were under the impression that certain tests were standard of care when it wasn't. So really, getting that patient feedback early on probably would have better prepared them for this.
Now, many of you touched on the importance of diversity and heterogeneity. Yolanda, was something that you emphasized. I wanted to ask each of you to comment on ways that your organization is really trying to improve diversity, equity, and inclusion in clinical research today. We've known for some time that this is an area that needs to be addressed, but it seems like there's a lot more being done right now. And Zach, maybe I can ask you to kick us off. What are some of the things that you're seeing that are being done or that your organization is doing specifically?
Yeah, of course. So, diversity is very important for, pharmaceuticals, devices, anything in healthcare, right? And so I think one thing that, we have a little bit of a competitive advantage because we are located in a metropolitan area. However, I just think that, going back to, having to make a patient feel comfortable the minute that they walk in the door really starts with how your community views your organization, how involved you are. I work with NAMI DeKalb, National Alliance of Mental Illness. I'm on the board there. And one thing that we've always talked about is not just, if, you don't just get a diverse patient population by driving in and setting up a booth and expecting, for your patients to look different, right? It really starts with the foundation of your company. We have taken an approach to really make sure that, number one, we've kind of defined what diversity even means for our clinical trials. And then also, going back to the basics, acknowledging wrongdoings in the past, acknowledging that research hasn't always been done properly, and having those hard conversations and talking about things, because I think however, everything is evolving, that it's, you don't know what you don't know. You don't know the exact maybe pronoun or the exact word to use, and just ask, right? Because people, as long as you have a caring heart and patients can feel that the minute they walk into your clinic, they're going to feel comfortable enough to talk to you about those hard conversations. So just a few things, right? We've definitely taken a step back to basics. Patients are number one. They're also our customers, our biggest customers. Having those open and honest, hard conversations, and not just, having conversations with, patients, but also employees, employee morale, right? If employees feel included and that you care about them, it's going to show in your patients, and they're going to feel more comfortable coming to your clinic. They're going to feel comfortable being honest with you when they've, lost a blister pack of cards because they got evicted from their homes. And those are the kind of conversations that once you can kind of build the atmosphere around, they happen. Getting involved in the community, I always say, don't just write a check and show up. Really try to, show up and support your community, get involved with the schools, get involved with churches. And then also just build a very diverse and inclusive physician referral network. We have 7 physicians from all walks of life, different therapeutic indications, and their patients will follow them to a research study. And when you have a staff, doctors, and a space that's caring and loving, your patients will show up and your trials will be more diverse.
My goodness, Zach really laid out quite a roadmap here. Leah and then Yolanda, can you now comment also? You both alluded to awareness and how important that is. It's a challenging thing to do when some certain communities may not trust the clinical research environment. Can you comment on some of the things that you've done there to really try to reach a diverse community of patients?
Sure. So over the summertime, we actually did a targeted radio roadshow to different areas of the country to really, and what we did was spent 15 minutes simply dispelling myths about clinical trials. And I had the privilege of being joined by a cancer survivor named Meghan, and he is the longest living CML patient from the original Gleevec clinical trial. And his story is remarkable. Wow. Yeah, he was given, only 3 years to live, and he has seen his daughter go on to Harvard Medical School. It's an amazing story. But what was mentioned earlier was, patient stories really resonate. It helps to build trust. And another interesting program that the Leukemia and Lymphoma Society has is called Myeloma Link. And so we know that Black Americans have an increased risk of developing myeloma. And so for that reason, this program is targeted in certain communities throughout the United States that focus on bringing in community leaders to help provide the education and to help lead people towards free services and really getting the best care possible, whether it's preventative or actual active treatment. So I think, the key between those two examples are really, making it real and helping to build trust is certainly step number one. And then leading people to good, reliable sources of information, rather than going down that rabbit hole of the internet sometimes where you may or may not get the actual evidence.
Well, Yolanda, can I bring you in? I saw a few head nods from you as well. There were some things that Leah said that obviously resonated with you.
Well, definitely the trust factor. That's really, really important. And one of our key pillars is building those strategic partnerships, right? So expanding and strengthening those relationships with patient groups, community organizations, to help develop investigators from communities of color that will enable us to recruit a broader population. Also, just recently, back in July, Novartis announced a collaboration with historically Black colleges and universities and others to co-create programs that address the root causes of systemic disparities in health outcomes. So we're working with different industry folks as well as HBCUs to help improve the pipeline of investigators that are coming through and being trained. So that way we can ensure that we're creating a greater diversity and equity across our clinical research ecosystem.
That's great. Meghan, I know you mentioned you really sit in the Office of Diversity at Genentech. Can you talk about some of the key initiatives and part of your mission and your charter in that group?
Yeah, thank you. I am just so excited to hear everything everybody's saying. Just let me say, from top to bottom, it's just so exciting. We have 3 pillars in the Chief Diversity Office. One is fostering belonging for our people, ensuring we have leaders of color at all levels. A lot of work going on there. We have Transform Society, where we have a lot of activity around corporate giving and kindergarten through careers initiatives for students of color in STEM, very long-term strategic work. But I know with patients in front of us, advancing inclusive research and health equity, I'm going to quote a patient because I love patients. Ricky Fairley, triple negative breast cancer thriver. She's an amazing patient advocate. Love her. She's like, turn that glass upside down, turn that computer upside down. We have to think differently. And what we're doing today is not enough. Better than maybe a year ago, but definitely not enough. You got to be in for the long game. And we're partnering with 4 amazing clinical research centers who are reaching their communities well, either Black African-American communities or Latino, Latinx communities well. And they are helping us co-create the educational material that some of you mentioned that we need, the indication agnostic clinical trials 101, is patient facing, also some HCP education around cultural competency. Amazing partners, O'Neill Comprehensive Cancer Center at UAB and West Cancer Center in Tennessee are 2 of the 4 partners. So I think we're really trying to listen better and go to where the patients are. So we've been going to centers to interview patients. And that's just, there's so much more that needs to be done. And I think, Yolanda, you mentioned something about going to where the patients were as well. Sponsoring health, we understand solving reach, community reach is a local. We need to think locally. So sponsoring health equity symposia that are local, and the sites decide what that symposia is composed of to help identify what are the gaps, what are the opportunities, how do we work with the community, with leaders, community leaders, and with our patients. So that's how we're trying to think differently and work more locally. But I love hearing what everybody is doing.
Mary, I saw a few head nods from you while Meghan was talking. Can you share Otsuka's perspective and some of the initiatives that your organization is getting behind?
Sure. One of the, one of the biggest areas we're really trying to think differently about is to what we call democratize a clinical trial. Go to where the patients are, and how do we deliver the patient to where they live, or deliver the study to where the patient lives. So we've been doing a fair amount of work with decentralized trials, and if folks don't know what that is, it's sort of like running a virtual trial or not. The typical way research works is a patient goes into a research center site, sees the research physician there, and generally the reach is limited to like 20, 30 miles. No, patients don't want to travel outside of that zone. So if you can offer a virtual trial where patients can be seen anywhere they live, they're not constricted by geolocation, that in itself offers opportunities to patients where we might not have a research center, or where we need to grow a research center, particularly in diverse communities where certain populations don't have a chance or have the time to participate. With this sort of trial, they can do things on their own time. That's a big pillar. Also looking at giving patients more choice. If you have to have a lab draw done in the office, but you can't come in from 8 to 5, we're looking for more unique ways. So maybe you go to your corner drugstore to have a blood draw instead of the research office, and you can do that at 8 o'clock at night instead of 2 o'clock in the afternoon. So a few aspects just on design. We're also being more prescriptive about a way we collect data or what we're collecting. It may seem very simple, but we've just started collecting data points around gender identity to be more inclusive of our LGBTQ community. Starting to look at here, one of the common criteria in studies is you have to be able to read a consent. Well, what if you have a visually impaired subject? We've been excluding those, and how do we be more inclusive of that sort of diversity? So taking a hard look at our own practices and thinking about those populations that have generally been left out. We're trying to take a very hard look now and be different.
And Phyllis, just to bring you in, can you talk about some of the ways that SysGrip has tried to improve its ability to be more inclusive and more focused on elevating a diversity in terms of education, public education?
So a lot of the work that our events and community engagement team does is grassroots, kind of back to basics, engaging in local advocacy groups and representing different medical conditions, different ethnicity groups, but hearing from, we found that when people in the community hear about something from an organization they trust, like one of these advocacy groups, they kind of sit up a little straighter and, take more of an interest and might actually click, register for event rather than just an email from SysGrip. So really that grassroots community engagement is where we found the most success.
So I just noticed, thank you everybody, we're getting quite a number of questions from the audience. So I'm going to combine a couple of the comments that you've made just to touch on a few topics, and then we'll go right to the audience questions. So Mary mentioned the transition, the use of more virtual and remote technologies, for example, and approaches to make it easier for patients to participate in clinical research. I just want to open it up to other folks on the panel. If you could talk a bit about how your organization is managing this transition to more virtual and remote support, especially when you're trying to also maintain your relationship with the patient. So maybe Tamara, if you could comment a bit on how your site has managed some of that transition.
I think definitely COVID was a turning point for us. And so we were in the midst of this pandemic and needing to find ways to continue to engage with our research participants. And so having virtual visits and telehealth options really helped us be able to continue to service those patients, even during doing COVID research, when there were clinical trials and you couldn't exactly be patient facing, to mitigate exposure, having that platform and virtual options definitely came in handy. And so you just sort of adapt, and it is useful, and it's helpful to expand sort of the outreach in terms of being able to have patients in various areas still be able to participate without, the fear of a commute or having to take off from work. It just, really extends the platform in terms of having options of being able to be seen.
Thank you. And Leah, you had mentioned earlier about some of the biggest myths or misperceptions, and I want to open it up to other panel members. If a few of you can share what you see often as some of the biggest misperceptions that patients or their families may have about clinical research. And maybe Zach, you can kick us off there.
Yeah, definitely. So I really agree with what Tamara said about just being able to, be able to access more patients with the virtual or decentralized trials, you might call it. And because of that, I think what really has happened is a lot of people are just now willing to have more conversations because COVID really helped research kind of be in a good light for a little bit, right? Because everybody wanted the vaccine super fast. One of the things that I've, recently a patient has asked that, they thought that you had to have, an illness or be diagnosed to be able to go into a clinical trial. And then the other thing is just that anytime that they hear something about, going into a doctor's office, they're like, well, how much do I have to pay for that? Right. So that's been one of the two biggest misconceptions I've heard lately, that, we're always trying to, promote the fact that, it's a great care option. It's no cost to you. And just that there's still so many people just to reach to kind of create a foundation for research and how they can access it. So.
Or anyone else want to comment on a common misperception that you might encounter, perhaps when you even tell people that you're involved in clinical research?
Mm-hmm. I have a story of someone who's at my work, and her mother was diagnosed with oncology cancer, and she was going to be in a clinical trial, and they're like, but I don't want to be a guinea pig. And so it's understanding and you should be empowered as a patient to get second opinions and third opinions to understand what your options are. And that a lot of work's been done on investigational meds before they come into clinical trials, but know what that is. And that you have this, I think, Zach, you mentioned it, the access to top experts in the field and vigilant monitoring. So you're given options early about what you want to do. And just, you can leave a trial at any time. I'm going to quote Miss Eva Carter from Alabama. She's an amazing one, dean of a community college. She's a triple negative breast cancer thriver. And Yolanda, you brought up historical distress. And she said, I'm not going to let the past dictate my future. I got the data. My doctor told me my outcomes would be, and this is for her, if it's a different indication, you still need to ask this question. But she said, I got the data. My doctor said my outcomes would be higher if I went in this trial. So there must have been some known information about this drug trial she was going into. And I did my homework and I talked to my trusted sources. And even the day before she was going to go into the trial, she talked to a physician she trusted, and he's like, don't do it. Don't do it. You don't want to be experimented on. And she talked to her husband. This is Miss Carter. I don't think she'd mind. who was a civil rights activist with Martin Luther King back in the day. And he said, get on the bus, fight. And she said, I am not letting the past dictate my future. She did her homework. She was completely empowered. She asked trusted sources. And for her, it was the right decision. It might not be for someone else. And I think what we all want in this room is folks to feel empowered to ask and get the answers they need to make the right decision for them. I hope I answered the question. I'm sorry, I get so excited about Ms. Carter because she's just an amazing.
No, and I wanted to mention to all of you that several audience members have been sending emojis, clapping, praising and congratulating the panel just on how caring and compassionate and sensitive all of you are. I think one of you mentioned, it might have been Zach, that patients are given quote unquote a sense that they're royalty, that they're getting the royal treatment. And several people have commented that they feel that they really are at the heart of the things that you're doing and that that you're involved with. A couple of questions have come in now that are really take it down to the direct experience level for someone who's considering participation. So I'll mention a few of these and then ask if any one of you wants to comment. Two of them really relate to thoughts and questions that you might have about the logistics in the study. One person asked, when do they find out whether they're going to be compensated for their participation? And another asked, can they inquire upfront whether they're going to receive the active study drug or a placebo? So can we start there? What are some things that you can tell someone to help answer those questions as they're considering a clinical trial?
I can take that question. So having coordinated trials for many, 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 many years, the answer to both of those is absolutely yes. So before you even sign up for a clinical trial, we are going to extensively give you all of the information you need to know via our knowledge of the protocol and by way of what we call an informed consent form. And the answers to those questions will be readily available in a properly prepared consent form. It will touch on patient compensation. You will know about all of the risks involved in the trials, all of your options, the benefits, whether or not you will be able to figure out if you're receiving active drug or a placebo. Oftentimes, depending on the design of a trial, you may not be able to get that information right away, but should something happen that warrants what we call breaking the blind, we can figure that out if it's for your benefit. And then oftentimes at the end of a trial, when everything's done, sponsors will sometimes share that information and we can let you know at that point. But definitely before you even sign the consent form, you will have all of that information and more to make a sound decision about participating.
Great, thanks, Tamara. Megan, you wanted to comment on that as well.
I love that, Tamara. Thank you so much. So a hard concept is placebo and standard of care. So Dr. Wakhisi at City of Hope explained it to me well. He said in most trials, if you're randomized to group A versus B, and you're often given a standard of care plus the investigational product, say A plus B is the standard of care, plus C, the investigational product, or in your another group where you get A plus B and a placebo. So not always the case, but often you're getting, when I did a Rituxan trial with RA, we were having patients in group A get methotrexate plus Rituxan. In group B, they got methotrexate plus placebo. So a good question to ask your physician is, what else are they giving me in addition to a placebo, depending on what group? Because you won't know what group you're going to be in. Even your doctor or double blind won't know. They'll just know what standard therapy you're getting during the course of the trial. And then everybody, of course, gets the same test, the same procedures, the same monitoring, the same imaging, the same information. But just, that's such a hard concept. So thanks, Ken, for letting me do that, because I asked Dr. Wakhisi how to explain that well. And I loved his, often you're getting standard therapy in both arms or all three arms. It's just you might be getting a placebo in one of the groups or two of the three groups. So
No,
I know
thank you.
that's not everything, but that's a piece, just a piece of information to think about.
Yeah, and that's a very important perspective. Leah, just a second, and we'll go to you. I also wanted to mention that in research that's been done recently, less than 15% of all clinical trials are only comparing an active drug to a placebo. It's usually a standard of care, or as you mentioned, Megan, it might involve a placebo and another therapy that's being compared to the investigational drug. But we need to really rethink how placebo is involved in clinical research, because it's sort of disappearing. Leah, I'm sorry, you had wanted to make a comment.
I'm sorry. I just wanted to say, to build upon that, for cancer clinical trials, a patient will never only receive a placebo. So
Right.
As Megan explained, in a cancer clinical trial, a patient may be randomized to either the control group or the study group, but that patient will always get a placebo plus standard of care therapy. So just an important clarification for cancer.
Yeah, no, thank you for that. So another question that has come in, someone wanted to know how their personal health information is protected and how their privacy is protected. So can I invite a panel member or two to comment on that?
I can comment on that. Go ahead, Mary. So here at Novartis, and I'm sure at other companies, we take data privacy very seriously. We even have our own data privacy group, data privacy lawyers. It's really important that the data that we collect is used for what it's intended to be used for. So whatever is written in that consent, and how that consent is written based on, and it tells you how your data is going to be used. That's how your data is going to be used. So they're very, they take it very, very seriously. And, you can always, ask your doctor questions and so forth, but all of that information should be included in your consent. So, feel comfortable to know that we take your data, your privacy data, very seriously.
Thank you, Yolanda. Mary, do you want to add to that?
Yeah, and I was just going to add from a sponsor's perspective, you're not even identified by name when your data comes into a sponsor. You're identified by a number. And occasionally we might get a document that has your name on it, and we have very clear procedures of how to obliterate, send it back, and retrain your sites not to send us any identifiable information. So it does happen on occasion, but as a normal practice, it's like I guess a number or an identifiable way of tracing it back. Your site knows, or your physician knows, but we as a sponsor would never know.
Great. Here's another question that just came through. The question is, right now during the pandemic, drugs seem to be developed much faster than they were before the pandemic. And this person says that some of the people they know, some of their friends, think that drugs are being developed too quickly. So this person wants the panel to answer the question, is this really what's going on? Are drugs being developed too quickly now during the pandemic?
Ken, do you mind if I answer that just briefly?
Of course, go right ahead, Megan.
A little close to this, just I think we all are because of COVID, right? So just a little information, a lot of the mRNA vaccine work was being done already for years because of Ebola and some other infectious diseases. So there was some technology and advances being made that benefited us for COVID. So it was in the works for quite a while, perhaps in different areas, but that's one reason we could go a little bit faster for some of the COVID vaccines. It wasn't even faster, it was just that we had done a lot of pre-work. We maybe even got a little lucky because the mRNA stuff was already in the works. So that's just one short answer. The other is, I don't know about folks in the room, but everybody put their resources on COVID that could. So we have some infectious disease work at Genentech. I've been lucky to work on some other things, but I can tell you the folks who worked on our Actemra trials were 24/7. and everybody pulled, and the sites as well. The sites were all there. 100, everybody was on it. It meant pulling people off of other things, but anything you could do to expedite finding a solution was being done at the site side, at the regulator side, just, yeah, it was a little, I'd love it to be that way for everything. And maybe it's going to help us expedite some decision making in other areas. But does anybody else want to comment on that or add?
Yeah, and just another point, and maybe I'll invite some of you to comment. The fact that they were faster, that the studies were faster, does not mean that steps were omitted, right? That we still followed the same guidelines, the same processes. We gathered the necessary data to support our studies. We followed the protocols, right? So to your point, Meghan, there was a tremendous mobilization of people really working longer hours, and that certainly contributed to the focus on coming up with and developing COVID vaccines so quickly.
And there was such a high unmet need, right? Patients were in dire need. So the enrollment was faster because patients really, really needed a solution. They were desperate. So it was kind of everywhere. People tuned up. But yeah, thank you for that.
I was going to add to the same thing, Meghan. You know, we're talking about how trials need to recruit more people. Well, the vaccine trials, I mean, they were closing before people could even enroll. I mean, so it is an example of truly how important it is to have participants in clinical trials to really advance the treatment.
And Ken,
Well,
I just also wanted to add,
go ahead, Yolanda.
just really quickly, you know, there are ethical guidelines and principles that we do follow in clinical research, such as the Declaration of Helsinki and the Belmont Report and the Nuremberg Code. So there are guardrails that we've used for the past 50 years that have been managed in accordance with a universal set of ethical principles that are widely accepted across the globe.
So we have time for one more question, and it's an interesting one. And maybe I'll ask Zach and Tamara if you have a quick response for this one before we close our discussion. This is from a parent who asks, who says that they have or are considering a clinical trial for one of their children. And they said that they have some concerns, and they also asked if there is any kind of treatment for their own anxiety if they were to put their child in the trial. So do you have any thoughts to help put them at ease as they think about a clinical trial for a child?
So I was a pediatric research coordinator for 7 years of my career. And so, yeah, the anxiety treatment would likely be your study staff. And so, you know, starting off in the field, I worked with adults, and making that switch to peds research was definitely interesting. I learned so much. And when you have great therapies that are out there that, you know, these patients would not otherwise have access to, and they help, it's just a tremendous feeling when you see that, and you can work with a patient who's just so desperately ill, and then they're getting better and their quality of life is improved. And so I think the comfort and the security of knowing that you're doing something right for your child comes with building that rapport and having study staff who are just there with you every step of the way. You know, to this day, I like to tell this story about one of my favorite patients, and peds research for me was many years ago. And it was a little kid who was probably 11 or 12 at the time. And today he's probably 27 or so, married, has a family of his own, but his grandmother used to bring him to all of his visits. And I still have a relationship with his family to this day. She loves to call me and give me updates all about this kid. And it's, well, he's a grown adult now, but I mean, you know, it is your study staff. You know, you have to build that rapport, and, you know, hopefully they gain your trust, and it will become more comfortable versus anxious for you.
Well, I want to thank all of our panel members. What a terrific conversation, a lovely conversation. As I mentioned, it really inspired a lot of questions from our audience, as well as emoji clapping and praise. And so thank you all so much. This was incredibly informative. And we want to thank our audience for joining us today as well for panel 3. And Hope, I'll turn it back over to you.
Thank you so much, Ken. And again, thank you to all of our speakers tonight for sharing your time and your story. This has been so helpful to our group tonight who's able to join us. I'd like to thank all of you guys for joining us as audience members, and just wanted to also take the moment to acknowledge any of our audience members who have participated in clinical research as well. So we want to thank you for your gift of participation as members of the community who are doing your job to advance medical research and science for all of us. We appreciate that very much. And we should have one more poll question up on the screen shortly, but we want to know if this is your first time attending this event, if this is your second, or if you have attended all 3 of our programs this week. We'd love to hear more from you guys about what you enjoyed and what you liked best. So there will definitely be a survey coming out in your follow-up emails this week as well. So definitely keep an eye out on that. Awesome. Love to see these responses. All right. Wonderful. Glad to see that some people have joined us on more than one program. I love to see that. And I also just want to remind everybody about our informational exhibit center, that remains open indefinitely on our website. So you can always see that. You can join us there, getting more information from all the groups involved, and see some of the other places that we visited this year and then brought this program to. But before we wrap up, we just wanted to move on to our raffle portion of the evening. So we have a couple great programs, raffle prizes tonight that we're giving away. And don't forget that there's also our scavenger hunt in our informational exhibit center as well, where we'll be giving away some local donated items from our organizations in the Atlanta area, and as well as an $150 Amazon gift card. So be sure to keep an eye out for that if you're poking around in there and coming up with that, looking through the informational exhibit center as well. So our first prize is a $100 Visa gift card, which is going to Ariana McBean. Congratulations, Ariana, and thank you for joining us this evening. We're so happy to have you. Be sure to check out your email after this program. We'll have some more information there. And then our final raffle item is a $50 Walgreens gift card. And that winner is Mario Phillips. If you are here, we are so excited. Please share to check out your email for more information on that as well. And as always, we hope that this is just the start of the conversation. There are so many different resources that are out there within SYSGRIP and our exhibiting organizations. We have our informational handbook that's available on the website as well, and that IEC that's available as always on our website. So thank you again all to who were able to join this evening or this week. And we look forward to having another program in your area soon. Thank you so much, everyone.